If you're tired of constantly having to stretch your back all the time, in this video, we're going to look at some different ways that you can address your low back pain without having to stretch. Now, if your low back pain is radiating numbness and tingling down your leg or into your foot or your ankle, this video isn't for you, but check out this video above instead. If your low back pain is centralized to your low back and it's just a dull aching sensation, this video is for you. The first way we'll address your low back pain is with some posture modification techniques. When we're sitting for really long periods of time throughout the day in a chair, at your desk, the muscles that help with your posture, that help you sit in an upright position, can become excessively tight. And some of the muscles that maybe you're not using or working as frequently if you're sitting in a chair for long periods of time get excessively weak. Sitting in a chair in one particular position throughout the day for long periods of time can exacerbate both of those problems, causing excessive tightness and excessive weakness in our low back muscles. So instead of sitting in a chair for long periods of time throughout the day and not activating those muscles, posture modification can help you sit into a different position for a particular period throughout the day, just to be able to activate some of those muscles that aren't being activated and help stretch passively some of those muscles that aren't being stretched while we're sitting in a chair specifically. One way we can accomplish a posture modification from sitting in a chair is sitting cross-legged on the floor. This particular posture can help stretch out some of the muscles in our low back that get excessively tight when we chair sit for long periods of time. And it also can help us activate some of the postural muscles or some of the other muscles that aren't activated when we're sitting in a chair throughout the day. This can also help with our hip mobility. So as you can see, my hips are externally rotated in this position. Having an effective hip mobility range of motion can also really help with low back pain. If our hips are tight, they're not quite moving properly, some of that movement will come from our lumbar spine and our low back, and that lumbar spine isn't meant to do some of the mobility activities that our hips can do. So making sure that our hips are nice and mobile and being able to sit in this position for about 30 minutes, you can do it 2 times a day, would really help alleviate some of that low back stress that you're feeling, some of that tightness you're feeling in your low back, and just help you feel a little bit better and less stiff. Along with sitting cross-legged, you can try adjusting your desk position a little bit too. So you could use a couch or a chair and sit in a cross-legged position for maybe about 30 minutes if you can throughout the day. That way you're doing a little bit of variation from chair sitting to cross-legged floor sitting, and you can try to get into a nice upright posture. Make sure that your mechanics are okay and you're not shrugging your shoulders too much or causing any issues anywhere else, but ensuring that you have nice upright posture, your screen is about level with your eyes and you're looking down slightly, and being able to sit in a variation position that can help alleviate some of your low back symptoms and get you in a different position throughout the day. You don't even have to just use your couch. You can stack up a bunch of pillows like I have here. And if you have a laptop or a portable device that you use for work throughout the day, sitting up nice and tall into this position and setting up your pillows strategically so that you're not sitting forward like we are in our desk position, and allowing us to have that variation, passively stretching our low back while we're working. And that way we're not having to sit there for 30 seconds times 3 or 3 minutes stretching our low back. You're just doing it sitting throughout the day, doing tasks that you normally do throughout the day, passively stretching those muscles, activating the muscles of your core that need to be activated, and allowing yourself to get that posture variation without having to stretch and spend that time doing that passive stretching yourself. Instead of actively stretching our low back as well, we can try some mobility exercises to help alleviate some of our low back pain. So we'll try this first exercise. We'll lay on the ground and we'll keep our feet nice and wide. And we're just going to slowly rotate both of our knees towards the floor at the same time, and then slowly rotate back the other way. You can perform about 10 of these on each side, and you can try these maybe once or twice a day just to help alleviate your low back pain. This is going to help with your hip mobility a little bit, so this will help increase some of that hip range of motion we were talking about earlier. And then to isolate our lumbar spine and our low back, what we can do is bring our feet closer together and we'll rotate both of our knees side to side just like we did earlier, but this one's just isolating our low back a little bit more. Same idea, we'll do 10 on each side. You can do this once or twice per day just to help get that lumbar spine moving a little bit to alleviate some of that pain. If you're getting value from this content, check out the link tree in my bio and consider leaving a tip of coffee. It really helps support the challenge. This next exercise is called the cat and the camel. It helps with your pelvis mobility as well as your lumbar spine and low back mobility, just to be able to get that moving a little bit. So what you'll do is you'll come down on the floor, hands and knees, and you're just going to rotate your lumbar spine down into an anterior pelvic tilt, and then you're going to rotate your spine up into a posterior pelvic tilt. You'll perform about 10 of these. This helps with the anterior posterior range of motion of your lumbar spine on your pelvis. This last exercise is a pretty aggressive mobility exercise for your lumbar spine, your low back, but if you aren't experiencing a significant amount of pain, just a little bit of dullness, and you just want to get the area moving, you can try this exercise. So you'll lay down on your back on the floor, just keeping your knees and your legs straight, and then you're just going to bring one leg across, hold that for a couple seconds, and then you'll return to the starting position, bring the other leg across, hold that for a couple seconds, return to the starting position. You could perform 10 of these on each side as well. This is a little bit, again, more aggressive of a mobility exercise, but that's a good exercise just to get the blood flow moving a little bit. And if you're having trouble sleeping because of an anterior pelvic tilt posture in your low back, check out this video above, and I'll see you over there.